What are the deadliest diseases and what is it like to die from them? This week I'm talking about end-stage liver cancer and or end-stage liver disease. So there's two reasons why I see people on hospice for anything to do with the liver. One, they have some kind of cancer that has moved to the liver and it's end stage, and or they have liver disease, either alcoholic or non-alcoholic, and it's end stage. Now, both of those people will look basically the same as far as symptoms for end of life. So here is what to expect. The main symptoms I see with patients on hospice for end stage, anything with the liver, they will usually always have ascites. Now, ascites is fluid buildup in the abdomen, so much so that they usually can look almost 8 months pregnant. That's how much fluid can be in the abdomen. So because of that, there can be a lot of pain and there can be a lot of shortness of breath because, as you can imagine, that can be uncomfortable. The fluid can push up on their diaphragm and make them short of breath. Now, there's good news. There are things we can do on hospice for that. So usually before the person comes on hospice, they are getting that fluid drained. So they literally have a needle stuck into their abdomen and it drains out the fluid, and they have to come every couple weeks to a procedural center and get that drained. Now on hospice, hopefully, and this is something you should note, before you come on hospice, I generally would say you should get a drain placed in your abdomen. So when we come in as the hospice team, we can come in and drain the fluid through the drain that was placed before you came on hospice. Also, a side note, there may be hospice companies that try to say they can't send you to a procedural center to get the ascites drained. That is not true. Medicare will pay for it, especially if it's to help manage symptoms. However, I will say that's not ideal because eventually the person will be too weak to go to the procedural center. So to me, the best bet is to get a drain placed. Now, of course, you have to talk to your doctors and your hospice company because everyone is different and some people actually can't have a drain placed, so it just all depends. The second symptom I see a lot is confusion or agitation. So why does this happen? This happens because ammonia levels rise because the liver is no longer functioning. So ammonia levels rise and the person with this disease will become more confused and more agitated. Terminal agitation is very high with someone who has end-stage liver disease for whatever reason. And how we can help that a lot of times is by just giving them a drug called lactulose. Now, it's a very sweet, syrupy drink that they have to drink multiple times a day, so that's not fun. But the lactulose binds with the ammonia and then the person will poop it out. So a lot of pooping along with lactulose, and that helps clear their brain a little bit so they'll be less agitated and less confused. Now, eventually that won't always work. So even if we're doing that, that will help, but eventually they will usually just be more and more confused. Now, hopefully once that advances, they're also very lethargic. So you don't have a lot of the agitation where they're trying to get out of bed or walk around when they can't, but they may be disoriented from time to time. And last but not least, pain. Now, it's not always, you do not always have pain with end-stage liver cancer or end-stage metastatic cancer to the liver or liver cirrhosis, but people can have pain. And good news there is hospice is great at managing pain, so we usually can get the pain under control. The one thing I haven't mentioned yet is bleeding. Patients with liver disease will have a high chance of bruising and bleeding from time to time. Also, they will usually be yellow. They will be jaundiced. Now, the jaundice will not hurt them, shouldn't cause any symptoms, sometimes some itching, but nothing that should bother them too much. They will just look a little yellow. Generally speaking, dying from anything end-stage liver related can be complicated from my experience. There's just usually a lot of symptoms involved. Sometimes the patients are young with terminal agitation, which is basically just someone not being fully aware, but constantly wanting to get up, constantly being restless. You can't really talk them down. So it can be hard for the caregiver. We can manage all of those symptoms on hospice, but it can be very difficult. So I would say caregivers having to deal with this is a more complicated, difficult disease process. And then last but not least, people with end-stage liver disease who are dying or end-stage liver cancer will go through the actively dying phase just like anybody else dying on hospice. So they'll have that end stage, which is typically looking like almost everybody at the actively dying phase, which is unconscious, not eating and drinking, changes in breathing, changes in skin color, terminal secretions. All of those things are not related to that specific disease. That's just related to the dying process and what actively dying looks like. It's important to know what to expect with certain diseases. The more we know, the better we can prepare and the more we can advocate for ourselves. That's why I will continuously educate about specific diseases so you can live better and die better.